and welcome to Lehigh University's College of Health Colloquium series. I'm so pleased you've joined us. I'm Beth Dolan, the Interim Dean of the College of Health. The Colloquium series this fall celebrates the Vince and Ellen Forlenza Endowed Faculty Chair in Health Innovation and Technology, a crucial faculty position in the College of Health for which we will be conducting a search in the spring. Our focus this fall on health innovation and technology encourages our community at Lehigh and beyond to consider the ways in which innovation and technology can positively affect the health outcomes of populations. This fall, we are collaborating for the first time with Lehigh University's Baker Institute for Entrepreneurship, Creativity, and Innovation. All Lehigh faculty, staff, and students who attend each of our colloquia are invited to the design thinking workshops dubbed the Opportunity Room, or OR, to be held a few days after each colloquia this fall. In those workshops, we'll have the opportunity to talk with one another about the problems each speaker identified that we are inspired to devote our talent and time to solve. I will post a registration link in the chat so that Lehigh folks can sign up to join the OR workshops. We have a great lineup of speakers this fall. Jumping ahead, in October, we will hear from Dr. Rebecca Jacobson, president of the startup Estrada Inc., a digital healthcare company specializing in natural language processing for quality and value-based care. In December, we'll host Dr. Stephen Tang, president and CEO of our neighbor, OraSure Technologies, a leader in the development, manufacture, and distribution of rapid diagnostic tests. Today, we're fortunate to learn from Dr. Karen Murphy, Executive Vice President, Chief Innovation Officer, and Founding Director of the Steele Institute for Health Innovation. Dr. Murphy will present a talk on innovation in healthcare for the first half of our time together today. In the second half, Dr. Murphy will engage in a conversation with Lisa Getzler, the Executive Director of the Baker Institute at Lehigh. Lisa will weave your questions into that conversation, so please enter your questions in the Q&A at any time during the presentation or conversation, and Lisa will do her best to get to most of them. It's an absolute pleasure to introduce Dr. Murphy today. She's a perfect first speaker for this series on how health innovation and technology can positively impact health outcomes, because she has worked to improve and transform healthcare delivery throughout her career in both the public and private sectors. Before joining Geisinger, she served as Pennsylvania's Secretary of Health, addressing the most significant health issues facing the state, including the opioid epidemic. Prior to her role as secretary, Dr. Murphy served as director of the State Innovation Models Initiative at the Centers for Medicare and Medicaid Services, leading a $990 million CMS investment designed to accelerate healthcare innovation across the United States. She previously served as president and chief executive officer of the Moses Taylor Healthcare System in Scranton, and is founder and chief executive officer of Physicians Health Alliance, Inc., an integrated medical group practice within Moses Taylor. Dr. Murphy earned her Doctor of Philosophy in Business Administration from the Temple University Fox School of Business. She holds a Master's of Business Administration from Marywood University, a Bachelor of Science in Liberal Arts from the University of Scranton, and a Diploma in Nursing from the Scranton State Hospital School of Nursing. An author and national speaker on health policy and innovation, Dr. Murphy also serves as a clinical faculty member at Geisinger Commonwealth School of Medicine. As Chief Innovation Officer, Dr. Murphy leads Geisinger's deep commitment to innovation, one of the organization's 4 principal values, along with kindness, excellence, and learning to fulfill the mission of caring. Geisinger is an integrated healthcare system that includes 13 hospital campuses, 2 research centers, the Geisinger Commonwealth School of Medicine, and a health plan that serves approximately 600,000 members. Geisinger's more than 30,000 employees, 2,500 providers, nearly 500 residents and fellows, and 360 medical students serve and care for the 3 million residents in Pennsylvania. I'd also like to mention that Dr. Murphy is a member of the College of Health Dean's Advisory Council, and we're so honored to have her help us build the college in that role. Her son also is an alumni of one of Lehigh's graduate programs in special education, so there's that connection as well. Please join me in welcoming Dr. Murphy. And here's where there would be applause.
Thank you, Dean, for the warm welcome, and it's my pleasure to be here. As the Dean shared, I do have an affinity for Lehigh because my son is an alum, and it's just a fabulous school. So really excited to kick off this series and really appreciate the invitation. So before I get started with my presentation, I just want to talk a little bit about why innovation is so important in healthcare today. So the healthcare industry is known historically for what I would say to be, developing long-term strategies and expecting short-term results, and then we drop that strategy and move on to the next. I think we have reached a point where we recognize that's no longer possible. And we have to really work at changing our healthcare delivery system because quite frankly, the cost is totally unsustainable. That's number one. But I think more importantly, and I'm really happy about this, is the healthcare industry is being disrupted from external forces that we've never seen before. So this year so far in 2021, $14.7 billion have been invested in digital health companies, outpacing 2020. And 2020 investment was 3 times 2019. So there is the industry of digital health is totally disrupting our traditional healthcare delivery system. The other very interesting, and I'm sure you're all clearly aware of this, but we're also being disrupted competitively from those companies that never participated in the healthcare delivery services. So think of Amazon's now entree into virtual care. Think of CVS Aetna into Minute Clinic's virtual care. So we're being disrupted by companies built with really strong digital platforms. And it is time for us to really take a look at how can we improve consumer experience, patient experience, healthcare delivery, while lowering the total cost of care. And the only way we can do that is if we start thinking out of the box. Next slide, please. So as the Dean shared my background, I was recruited to Geisinger 4 years ago this month, celebrating my 4th anniversary here at Geisinger, to create the Steele Institute for Health Innovation. The Steele Institute, named after a former CEO of Geisinger that really put Geisinger on the national map, and he was believed very strongly in innovation. So we developed an institute in his name that really, I would say, puts discipline and focus on innovation. And that those words don't always seem to come together. But the reality is when you're innovating, it is a process that we have to, that it's a very deliberate process. And I'm going to talk a little bit about how we do that today. But the Steele Institute was born 4 years ago when David Feinberg, who recruited me, when I said, well, what do you want the Steele Institute to be? He said, I just want it to be built based on our values. So these are the values of the Geisinger system, and we think about these values as we're innovating. Next slide, please. So what do we do? At the Steele Institute, we believe that our innovation is really not only for our communities, our employees, our patients, our members, but also for, as I said, focusing on affordability and also focusing on how can we develop things that are innovations that are generalizable, not just Geisingerizable, right? So we say we Geisingerize things. That means you can't take it out of Geisinger. We try to develop innovation that is for the greater good. And we feel that that's one of our really key responsibilities, and that we have to produce better outcomes. Next slide, please. So I shared the purpose. I think this is really important so you understand the perspective that we're coming from. We define innovation as a fundamentally different approach to solving a problem that has quantifiable outcomes. That means if it's not a problem, we're not working on it. If it's not a fundamentally different approach, it really is performance improvement, right? So when you think performance improvement is very important, but it is not innovation. We have to use fundamentally different approaches, and we have to measure, and it has to be quantifiable what the outcomes are that we're trying to achieve. Next slide, please. So if you think about it from Geisinger's perspective, the dean shared with you the size of Geisinger. We really operate in a hub and spoke model in that we have a team that works with business owners outside of the Steele Institute to really develop and partner to develop solutions that result in better outcomes. Next slide, please. So this is an overview, and I'm going to give you, I'm going to provide with some examples on each one of these areas. But this is a picture of really showing the different parts of the Steele Institute. So we apply human-centered design approach to solving problems and deploying resources. We house the data informatics shop, which is 25 years of EHR data from along with 82 other sources of data. We believe heavily in data-driven decision-making and maximizing data to innovate. So that's very appropriate that informatics would be in our shop. We do clinical redesign. We're going to talk about social determinants of health and population health, innovative approaches, payment transformation. Geisinger Innovation Ventures is the team that leads us if we decide to co-develop or partner with a company outside of Geisinger. We have a behavioral insights team. We use intelligent automation, robotic process automation to improve clinical and business processes. And then finally, artificial intelligence and digital transformation. So you can see that as I started to talk about the disruption that's going on outside of the industry, the Steele Institute has really been organized, and we have grown to really focus on that digital transformation. And I want to emphasize that when we talk about digital, we always say it's an enabling strategy. It isn't the strategy. I'm going to talk a little bit more about that as we go on. Next slide, please. So this is just a slide that we say we are leveraging our current assets, which is a huge clinical platform, which is, as I said, our data, stable population, to really develop new capabilities and really trying to solve the problems that are facing the industry and Geisinger today. Next slide, please. So a couple, this is the health innovation that I talked about, innovative approaches to population health and social determinants. I'm going to just pick out a couple of examples of the SDOH work. Fresh food pharmacy is one that I'm going to share information. So fresh food pharmacy is now 4 years old, and it has been designed to use food as medicine. We identified patients with type 2 diabetes and prescribed fresh food to actually treat their diabetes. And we've seen some really extraordinary results of lowering hemoglobin A1C, which is a measurement of diabetic control. We've seen significant weight loss, and we've seen much more engagement in primary care. So really excited about that. Free to Be Mom is a program that's close to my heart, really because of the work that I did when I was at the state on the opioid crisis that is very much with us today. This program, Free to Be Mom, identifies pregnant women who enter medication-assisted treatment for opioid addiction. When they enter the medication-assisted treatment, when they're pregnant, we swoop in, surround them with social services, and stay with them after their baby is born in hopes that we can increase the probability of them staying in recovery. So it's not a medical program, it's much more of a social services program, but we're testing to see if we can come up with the right mix that enhances the likelihood that moms will stay in recovery after their baby is born. Next slide, please. This is a piece of technology that we're using all over the enterprise and in all the communities we serve. It's called Neighborly, but it's a resource for those who need information on where to get help. I think it's, I'll give you an example that during the pandemic, we launched this site and 40% of the activity on the site was looking for food. So it focuses on the social determinants of health and and all of the social services that that can be obtained. It's for providers, so it's for physicians, and also for patients that are looking for help in these areas. Next slide, please. As I talked about the fresh food pharmacy, we provided 1 million meals over the last 4 years. What's next for us is we're expanding beyond diabetes, entering other disease states to see if fresh food can really be prescribed to enhance outcomes in other diseases like cancer, particularly when patients are going through chemotherapy or radiation. And we're also moving from, we have 3 brick and mortar sites. So 3 actual fresh food pharmacies located across Pennsylvania that patients actually go and pick up the food. We are now transferring our experience from the fresh food pharmacy to a digital application so that we can expand, bricks and mortar labor. There are all restrictions on how fast and what kind of spread you can have, but we're now looking at a digital application that will be able to be utilized by many more for this really wonderful program. Next slide, please. This is an example of how patient care redesign. We're redesigning the way we take care of patients with chronic diseases. So diabetes, congestive heart failure, hypertension. Right now, the way we take care of those diseases is case management. You'll be assigned a case manager. They'll call you once a month. And really, it's transactional in that you may have 30 days in between visits, which is not ideal because, first of all, you can't expand the number of people and the number of touches if you have to have a human being do it. The second piece is you're banking on the patient staying stable for 30 days in between those touches. And we can have the ability, if we had more frequent contact with patients, to really decrease advancement of the disease, prevent exacerbations, prevent unnecessary utilization. So we've partnered with a company called Noteworth, and we are really taking it to the phone. Patients download apps and are in continual contact with their case managers, that we can actually signal a problem much faster than we could when we were doing more traditional intervention. So we call it Geisinger Connected Care 365. Next slide, please. We're also applying artificial intelligence to Connected Care 365. We're collecting, ingesting patient-reported outcomes and synthesizing that outcomes to say, from a simple, this is an example of how we collect data from a patient that would ordinarily have chronic obstructive lung disease end up in a hospitalization, but they report much earlier that they have changes in their condition, and we can intervene by the algorithm identifying the last time that Jane was 55 years old and she reported increased cough with phlegm, temperature elevated, fatigue, decreased activity. That sparked a hospitalization. So we can now, when that algorithm picks up those symptoms, patient reported by Jane, we can now intervene and actually treat Jane at home much faster before she goes into the hospital. Next slide, please. And this is an example. These are just more examples of Connected Care 365. Has made it tremendously more efficient for the case managers. They saved an hour in their day by just converting to this application. So you think of that gives those case managers back an hour to actually take care of patients. It also gives them, as I mentioned before, a prioritized list of patients that really need to be addressed today, as opposed to my schedule of what I've always done and not having any insight. So we're very early. We've learned a lot in this journey, but we're really excited about it, and it's one of our future innovations that we're trying to launch. Next slide, please. As I say, quantifiable outcomes. These are just the outcomes from Connected Care 365 that we will be measuring to be sure that our innovation was actually successful, and we see some good outcomes in these KPIs that we're measuring. Next slide. Excuse me. Our behavioral insights team. So it's our nudge unit. You may have read about nudge theory. Nudge theory is that there are ways that we can manipulate messages to actually change behavior. So we're trying to nudge patients and providers. You get nudged every day that you walk in a grocery store with the location of what items the grocer actually wants you to buy. They're at the end of the aisle. So if you think about that theory, and you can go to the next slide, these are behavioral interventions that we have successfully launched. The University of Pennsylvania was the first healthcare entity to launch a nudge unit, and we frequently partner with them on research studies. But if you take a look at these nudges, the way we communicate it with patients, actually, we do A/B testing on all of the nudges that we do. But you can see here that we nudged successfully for uptake in COVID-19 and flu vaccine over the last year by just communicating in different ways. Next slide, please. So now I want to talk about our digital transformation and our automation, informatics, and artificial intelligence programs, and just give you a couple of examples. You can go to the next slide. Thank you. So our digital strategy, we always say we launched our digital strategy in February of 2020. And we had, this elaborate strategy that we had 9 months of developing and taken to the board for approval. And then, we announced the Digital Transformation Office. And 15 days after we announced the strategy, the pandemic hit. So we had to completely, I will tell you that we relied so heavily, and for really the Steele Institute, I have to say that the pandemic, the silver lining of the pandemic was our capabilities for innovation, and doing rapid innovation during the pandemic really was very beneficial for the Steele Institute, because we could support and we could share our work with the enterprise. And it was really, we have to look for all the silver linings we can from the pandemic. And that was one of the silver linings we found. So our motto here is making better health easier, in terms of what we're trying to do with our digital strategy is make better health easier. And when we talk about the outcomes that we're looking at on the bottom, we're talking about not only are we looking at making better health easier for patients, but we're also looking for making better health easier for care delivery and the providers that deliver the care. Next slide, please. This is the way we approach our digital transformation. I usually have a red line through digital and just have transformation office on the slide, because the reality is we cannot just digitalize what we're doing today. We have to transform. And the advantage that an Amazon, quite frankly, has, or a CVS Aetna, is they're building and innovating from the ground up they have a clean slate of paper. They have a clean piece of paper when they're starting their innovation. In healthcare delivery, it is very challenging for us because we have a bricks and mortar traditional care delivery system that part of what we have to keep intact. You're never going to have surgery sitting in your living room. You are never going to have, you're not going to have, we don't want you to stay home with a heart attack. So we have to keep this bricks and mortar system up and running and innovate on that side, while also virtualizing and digitalizing the consumer experience to the way that makes sense and improves experience. So digital, we should take the word out and just think about transformation. Just think about, how do we take this huge bricks and mortar care delivery system, how do we make it in a way that we take advantage of digital technology, but really have it be transformational? And this is the approach that we take in order to do that. Next slide, please. So as I said, the power of digital pre-COVID, we were really focused on, I would say, a much more conservative strategy. During COVID, it really brought home to us how we needed Connected Care 365, how we couldn't depend on human beings to answer 30,000 phone calls a day. We had to go to chatbots. We had to be using real-time data, and we had to take some of the capabilities that we had and really accelerate. And I say we accelerated in hours and days instead of weeks, months, years. So our whole time frame, I mean, we would identify a problem and they would say, like, we need it by Friday and this is Tuesday. So our teams were like staying up 24/7 to really address this. And then I think, unfortunately, we're not post-COVID yet. But when we do get to post-COVID, and we're starting to work on many of these things right now, but it is very clear to us that the way to transform is really by leveraging technology as an enabling strategy. Next slide, please. So this is some of the examples that we were able to help with during COVID and our response. So we developed a COVID website assistant. So if you, instead of having somebody answer that phone to answer questions, because to tell you the truth, most of the questions were the same coming from patients. So we developed a website symptom screener that would respond to patients to answer their questions and guide them to the right place. We developed an automated phone bot that took all inbound COVID hotline calls they were answered by a chatbot. We handled, the first wave of COVID, we called every person that had a positive COVID test with their results on the phone and negative during the first wave. During the second wave in January, the numbers were just too extraordinary. We could not do that. So we developed a bot that actually did outbound result calls to someone's phone to give them their COVID results and actually walk them through what steps they had to take if they were COVID positive. And then you can see some of those other examples. But the point I want to make here is that we rapidly innovated, solved problems, and as you can imagine, the staff that was working on these, each one of these areas, we had to build an infrastructure that didn't exist to manage the pandemic. And it was really our team that stepped up and really supported that work. Next slide, please. So this is an example. Overall, we're working in the pediatric space. We're working in the adult medication or adult space. We're working in telepsychiatry, all different, really different ways that we can disrupt our system. This is pretty much some of our high priorities right now that we're working. Some are foundational technology platforms that we have to build in order to really get to those places that we want to go to with the consumer experience, and then some, as I've already described. Next slide, please. And you can go to the next slide. So what do we do with our data? We make better health easier by looking at using our data wisely, particularly in the area, I would say, of providing data in a different way and analyzing data to really turn it into information as opposed to sharing data. So we have a really great team that works on and leads our work in clinical decision support and AI and predictive models. Next slide, please. So talking about artificial intelligence, the one thing that we've come to realize is that there's a big push in artificial intelligence in healthcare, and what is it going to do? What are the key places that we have to apply artificial intelligence and machine learning? There's no doubt that there is tremendous benefit. However, we want to be sure that we're not doing it just to do it or just because we can. So we start out by saying we spend a lot of time on the left side of actually looking at the data science, but then we take the time in the design process to say, how am I going to use this data and what are the outcomes going to be? To send me a list of 45,000 patients that are at high risk of something, I always tell the data team, don't bother, because I can't do anything with that. I have to be able to make that data actionable to be able to produce a valuable outcome. So we do keep the motto, just because you can doesn't mean you should. So we're very focused when we're talking about our artificial intelligence. Next slide, please. This is a great example of a good use of artificial intelligence and machine learning that we partnered with a company, an Israeli startup called Behavioural, and we created a predictive model for patients who is at high risk for lower GI disorder and really requires screening. So these would be individuals that were identified through the algorithm, did not have our colon cancer screening or colonoscopy. And we identified who's at highest risk. We then intervened and called those patients and said, you need to have a colonoscopy. So we scheduled 51% of the patients agreed. and ended up that we believe that just in the first year, we saved 5 to 6 lives by identifying colon cancer and early signal of colon cancer in our patients, and saved over $500,000 annually for those 5 to 6 patients, because they would have had a prolonged treatment. And we have this running now, and we've now embedded it into our regular operation. Next slide, please. Next slide, please. So this is an example of where we use robotic process automation. And RPA, again, replaces, looks at lower intellectual functions that a chatbot can do. And we're at this now for probably the last 18 months. And we have our own team that develops chatbots. And our goal is to really embed it through every business process and clinical process that we can. So this is just an example of, we looked at our Geisinger health plan. We have 3 bots that are continually updating the records of Geisinger health plan data and cleaning data integrity. And we looked in, just as you can see, the first 2 phases, we saved 7,000 hours. And so far in phase 2, $58,000, $133,000 the first time. But we were able to pivot those employees to do other work. And that really is the example of how you can use RPA. This was one of our first, really one of our first forays into robotic process automation. Next slide. I think this one is the most stunning when you talk about the examples that I gave before about you helping during COVID. When we look at what we built with automation during COVID, for just the results, the result calling and outbound calls, we saved over close to $8 million in just that bot, because of the army of people that we would have needed to do all of that infrastructure work. So I'm really proud of that. So in the beginning, when we started RPA, we had to sell it. Now we can't keep up with the demand because everybody understands what the value is. Next slide, please. So just again, solving problems through digital transformation, automation, and artificial intelligence. The problems that we're solving, you'll remember I started out by saying that we were making health easier, making better health easier. And we're trying to do this through leveraging these specific technologies. Next slide, please. So it really has been my pleasure I'm really proud of this team and proud of the work that they've done. They're an incredible group of people. And I think we live in a culture of innovation at Geisinger that makes our work easier, because people want to, people embrace innovation. Sometimes we just can't do it enough. But I will tell you, I started my career out, as the dean said, as a registered nurse. I was an ICU nurse, spent 10 years at the bedside, and really learned to appreciate the complexities of the healthcare delivery system. And it is really, really complex. And if we're able to develop one, and I always say this, if we develop in 5 years one innovation that really moves the needle on cost or quality, I will really be happy. So I'm happy to answer, looking forward to talk to Lisa with questions. And I really thank you for taking the time to listen today.
Thank you so much, Dr. Murphy. This is the part where I regret that we're on Zoom, because we should be having applause and a feeling of gratitude for what you just shared with us. I'm sure people are going to have a lot of questions. That was, you guys are doing a lot of really innovative work, and it's, I'm looking forward to, Lisa talking it through with you in the conversation. So I want to introduce Lisa Getzler, who will be leading the conversation with Dr. Murphy. Lisa is the executive director of Lehigh University's Baker Institute for Entrepreneurship, Creativity, and Innovation. And that institute is designed to create a culture of entrepreneurship across the university, promote innovative thinking, and foster the realization of entrepreneurial ideas. So thank you, Lisa, for bringing that spirit to our Colloquium series, both in this Q&A and then in the sessions that will follow each Colloquium called the OR or Opportunity Room. And I'll turn it over to you. Thanks so much.
Thank you, Dean Dolan. I so appreciate your including the Baker Institute in this wonderful Colloquium series. So let's start with the idea that first, the amount of information you shared with us, Dr. Murphy, as well as the inspirational aspects of what it means to actually innovate, not to talk about it, not to act like you're innovating, but to take the steps and measures that through the Steele Institute, Geisinger has committed to. I want to visit the idea that you mentioned that discipline and process are needed for innovation. Can you talk a little bit more about that?
Sure. So first of all, I'll tell you, this is the hardest job I ever had in my life because it's hard. We have a list, and I always tell my team, we should have a list of failures, because if you don't have a list of failures, then you're not innovating. So really, really, I would emphasize difficult work. But I think when I refer to discipline and focus, it's very easy to get distracted with innovation. I can tell you that I get calls or emails from probably 50 startup companies, could be in a day. I mean, the world is exploding with digital innovation right now. And I think what I meant by discipline and focus is you really have to identify what problems you're going to solve and that you are solving problems. So historically, I think where innovation really fell short in healthcare was we found the shiny new nickel, and then we went out and tried to find a problem to apply the shiny new nickel. When we're talking about discipline and focus, we say, look at that definition of innovation, and we have to stick to that. So what is the problem we're trying to solve? What is the fundamentally different approach, and how are we going to quantify it? Is the way we maintain the discipline and focus.
So thinking about all the pillars, all of the areas in which you are innovating, and all the different cross-functional teams that come together to solve problems, what is the process for identifying the problems?
So we have an intake process. I'll use, it's different. It's actually different for all those different sectors, right? So, or pillars that I mentioned. For robotic process automation, we have a very elaborate intake process that analyzes what the problem is, what the potential solution could be, and what's the return on investment. So we invite across the enterprise, submit where you think a chatbot could be helpful. And that's how we prioritize the work there. For digital transformation, we try to pick the largest areas of problems that people are having today, and develop our strategy by really engaging clinical and business leaders to identify what those problems are. So it's really a mixture of a very organized process. And then I would say Connected Care 365 was a clear example that we were expending a lot of dollars on chronic disease management. And quite frankly, we're limited as to how far we could go. So we decided to take that one on. And that, was a huge problem, but one that if we can figure out the solution, we can really move the needle.
Mm-hmm, mm-hmm. So you mentioned that incremental improvement is not what you're after. You're after true innovation. And one of our audience members has asked the question, or has stated, one challenge they've seen is improvement project teams are not always aware of what's available out there, what technology opportunities exist. So how do you embed yourselves in those groups, in those project groups, so that you can be more proactive in suggesting use versus being a department that people go to in order to be innovative?
Yeah, and I think, and that goes back to the discipline and focus, right? So, I mean, the reality is we have to be realistic with time in terms of times and resources. You know, I don't have, like, we could hire 400 people. That would be great if we could have 400 innovators run around. It would also be chaotic. So I think it goes back to prioritizing in the right way, intervening with those performance improvement areas. You'll always need performance improvement, but I think sharing our work with those performance improvement teams to prioritize where we need to really hit on all cylinders. And unfortunately, you know, we can't always do as much as you really would like to do because you have limited time and resources.
Well, that's a really good point. And obviously prioritizing is a key factor there. You mentioned the KPIs that you use. So related to that, and understanding that rapid innovation to solve problems in an industry that has been slow to change traditionally, is clearly how the future must look, and you've laid out a process for that. But what are the barriers to innovation and transformation that Geisinger is facing right now?
So I think the barriers to innovation it starts out with the complexity of the system. So like, as I said, we have to keep the bricks and mortar, that we have to do surgery, we have all that system, and then we have to figure out how do we virtualize and digitalize and transform. I think the complexity of the system is definitely one challenge. I think the second challenge is that there's competing organizational priorities. So while my priorities are my priorities, they're the most important to me, there's also, you know, hundreds of other strategic activities that are happening throughout the organization. So prioritizing is really, getting others to buy into your prioritization is pretty challenging. I think clearly the change management piece, you know, we've done it like this, works. Why are we changing? That's another barrier. I think funding for competing projects, that, you know, the digital strategy is a very, very costly investment for the organization to make. I think we want to be sure that we're good stewards of that funding that we have. And I would think that, and not moving when, and I always say happy that we have the disruptors, the Amazons, the CVS Aetnas out there, because they are moving us, they're making us move faster. And I think in the past we didn't move, as an industry, we didn't move quickly enough.
So how patient is the world of healthcare? You're 2 years old. You are making change as rapidly as is possible, given the constraints that you are working within. Again, you're in an industry where there is, high amounts of regulation, and yet you're able to innovate in some circumstances as quickly as humanly possible. But the healthcare industry itself has to, is your customer in some ways, and as well as your stakeholders and participants. So how patient is Geisinger for the work you're doing? And in the larger question, the healthcare industry itself, how soon do you have to show value?
I think that's a really important question in terms of lessons learned. I think it silver lining of the pandemic is everybody got to see what the Steele Institute could do. Downside of that was we did it inhumanly fast. bigger things like Connected Care 365 can't be done in a week. So setting clear expectations to say Connected Care is a 5-year project. It is not something that we're going to decrease. You know, we're going to show those KPIs moving in days, weeks, months, if that's not the case. So I think the industry, again, we're infamous for implementing long-term strategies and expecting short-term results. And I think as an industry, we're pretty much keeping with that theme with innovation. I think the only thing you can do as a leader is to communicate clearly at the very beginning of when you launch an innovation that this is something that, you know, don't come to me for 2 years before, you know, it took us 2 years to design Connected Care. And before we launched it, I think everybody was so sick of hearing about the design. But the reality is that's one of the most important aspects of innovation is the design process. So, you know, I think the bottom line answer is we're impatient as an industry, and we're looking for these solutions to real problems as quickly as we can get them.
Well, thank you for that candid and really insightful answer. I, you know, certainly in my work and in the Baker Institute at Lehigh, we recognize and spend a lot of time with students and faculty and others who are interested in innovating, identifying the problem, as you say, that, or maybe Albert Einstein said, if I had an hour to solve a problem, I'd spend, 55 minutes on understanding the problem and 5 minutes on the solution. And certainly that equation doesn't always work, but the point being that understanding the problem and framing it correctly is the lion's share of the work when it comes to heading in the right direction. So I really am so appreciative of the work that you're doing just from that perspective. And it's such a good model for us on this end of the conversation. So as we described, we're going to spend some time with students and faculty and staff who want to actually look at some of the problems that have sort of sparked for them today through your conversation to say, well, what can I be doing? Where can I be working on this? Is this some research I can do? Is this a startup I might conceive of? So thank you for underscoring the importance of that. I wonder if we could turn to the data side of the conversation. We have a question that came in around security. So with so much reliance on automated systems and electronic health data, what are the security implications and how do you keep the information safe?
Yeah, and I would tell you that that keeps us up at night. So we have an information security office that we're not permitted to ingest data without clearance through the experts. That actually, when we're contracting with external vendors to do this work, those information security experts really go through everything with a fine-tooth comb to be sure that we're not putting patient data. We have a data and ethics committee that, you know, data ethics, the ethical use of patient data is really very important here at Geisinger. So we do have the experts that are able to look at vendors, that are able to look at our use of data and be sure that we are utilizing it in a secure way that would prevent a breach of what I think is the most coveted information, your medical, you know, your personal health record. And we always want to be sure that that we act responsibly when we're ingesting such important information.
Of course. So the level of complexity around data usage at all, it just is, it exponentially increases probably all of the challenges that you face when innovating in other ways. So somewhat related to that, I was thinking about the example that you gave of the colon disease predictors. So in thinking about that, and you mentioned that some percentage, I think about 55% of patients actually acted on the recommendations. So is there an implication there for long-term insurance challenges around those who do not act on recommendations? And I'm guessing that that's related, of course, to any kind of diagnoses and suggested treatment plan. But do you see any future complications related to that?
Yeah, I don't. And the reason why I don't is we've been talking about for years, actually differentiating based on, there's a fear of genomics, of getting your genetic material tested that can, insurance companies discriminate against that. I really don't, I am not concerned about that. I think when you're looking at predictors and identifying high risk conditions, it concerns me more that we're communicating effectively to patients what these findings imply and what the potential implications for you could be, from a health perspective, not from one of liability or one of future discrimination. Now, if in order to, the one thing I could say going forward, but very hard to get buy-in on that, there has been discussions in the industry. Could we say that if you're recommended that you have to get a mammogram every year, you have to get a colonoscopy, or we're not going to insure you. That discussion has gone nowhere, for a multitude of reasons.
Well, that's good to hear.
Yeah.
So thank you for illuminating that subject, which is disturbing when you think about where it could go. So let's talk a little bit about nudge theory. Interesting for you to have included that in your talk. Obviously, it's something that when we hear about it, we say, oh yes, of course, that's what's happening. Oh yes, of course, we know that is part of how we consume information. So is that something that is now becoming more common among healthcare providers? Is that something that's common practice now? And you're using it in ways that perhaps you hadn't before, but now that is the norm. Is that the case?
I wouldn't say it's the norm, but I would say that it's a much broader practice with it. And when you look at the University of Pennsylvania and their nudge team, which really they were the pioneers, and then our nudge team came shortly thereafter and worked real closely with Penn. I think we have discovered a value in those behavioral scientists, excuse me, to really be able to advise us on, the problem now, and I'm going to give this plug because I didn't give it yet. Everybody make sure they get their COVID vaccine and their flu vaccine this year. But you take those two issues that have been hugely problematic over the past several years, and particularly everybody understands the COVID vaccine issue. But, to increase 3% adherence means a lot when you're talking about a big population. So when you have this, I think that their work will become, as they get their work out, will become more effective when other organizations, they can't have their own nudge unit, but can say, hey, Geisinger or the University of Pennsylvania developed this nudge and it worked for them. Let's just put it in. So I think that I don't think every hospital is going to have, or health system is going to have a nudge unit, but hopefully it'll be prolific enough that we'll be able to disseminate the nudges that work and others can adopt them easily.
And what is the role of the providers, especially the mega providers like Geisinger, in the misinformation that exists among our populace around COVID in this case, but certainly, at other times in the world, there is misinformation that is proliferating. How much of that battle can Geisinger and your peers and competitors make a difference there?
I think and our team led the vaccine initiative here. So I've been for the last year living COVID vaccine and really from a public health perspective, we've never seen anything like this. There has never been a time in the history of public health that that health professionals and public health professionals communicated strategies to address a disease that there was such hostility to. I will say hostility. It's not just like I'm thinking about getting a vaccine. It's like there's a group that says, just no way am I ever going to get a vaccine. Had we were able to combat that, most public health professionals, including myself, believes that we now would be heading into a normal fall, normal winter. It would be like the flu. Like if we had the population immunized as we thought we would when we started last December. So what our role is that we continually try all different approaches to education with whether it be holding press conferences, whether it be publishing op-eds, whether it be taking ads out in newspapers, whether it be through the web. We have tried, we held town halls for our employees and our leaders almost every week during the pandemic. We're down now to every other week. I think the challenge here too is that we don't have a tolerance to recognize this is a once in a 100-year event. And as the information came out and it changed, it allowed the voices of disinformation to really, it energized the disinformation. I think that's one. I think secondly, and you can't combat that. I mean, you can only combat with accurate information. I think history is going to look back and say social media played a huge role in disseminating the misinformation that has really prolonged. And, again, if you ever told me in March of 2020 that we were going to lose more lives in this pandemic than we did in 1918, it's truly heartbreaking to us that have dedicated ourselves to healthcare delivery. It's just absolutely devastating, along with obviously the families that lost those, but it's heartbreaking.
Yes, it is. And I can't frankly imagine being in your shoes, yours and the shoes of your colleagues, but we are grateful and we hope that the trends and the tide turns. So let's talk about you for a little bit. So we know you're a critical care nurse, and you shared with me when we met yesterday that you loved that work.
Mm-hmm.
And you did it for a long time.
Mm-hmm.
Was there a time, a day, a moment in your career when you said, I can be an innovator, I can be someone who makes change in this world that I am so immersed in and am so passionate about?
I probably shouldn't say this, but I always say that if you said to me when I was an ICU nurse, that this is where I was going to go, I would tell you that's crazy. So no, I don't think my career was. I think the only thing about my career that was consistent was I always remained open to possibilities, and I got bored quick. So I always, in terms of, when I left the job as president and CEO of the healthcare system to go to the Center for Medicare and Medicaid Innovation in Baltimore, I loved health policy, but I didn't have any idea of how a government operates. And I would just tell, everybody that I mentor, I just say, keep an open mind and don't ever outrule possibilities And that was much more how my career evolved than, I'd love to tell you I had a plan. I didn't.
Well, I actually resonate with that 100%. So I appreciate your sharing that. I would redirect one phrase from your statement, I got bored easily, to perhaps I'm a very curious person. I think curiosity and entrepreneurial mindset are how we make change, are how we innovate. We must have that at our core. Would you agree with that?
I do. Well, I think the other thing is you have to be passionate about, if you're going to be happy, you have to be, and productive. I think you have to be passionate about what you're doing. And sometimes I think the intensity, that when I said I got bored, the intensity for how I work is pretty ramped up. And so I put everything the positions and quite frankly, the ones that I didn't feel like I wanted to do that, I left. Because if I wasn't passionate about what I was doing and felt that I could really make a difference and a contribution, then I really didn't stay with that very long. I think the other thing to be an innovator, you have to be a risk taker. You have to be comfortable with failure. You have to be, sometimes I think people that innovate, you just put those blinders on and don't think about, the cliff that you're about to walk off. And I think that would be the other thing in my career. I didn't know that I was a risk taker. I think I didn't know what the risks were. I didn't allow myself to think about them. Some of them were really risky, and it's, I was just really lucky that they turned out well, because they could have gone the other way.
Well, I appreciate that. I do want to just underscore that conversation around failure and how embedded that is in the innovation process, and that we spend time with students creating failure resumes, where we are unpacking every failure to figure out what is the story that came out of that for you? What did you learn, and what will you do differently as a result of that? So that is certainly something that resonates with us at Lehigh and at the Baker Institute in particular. I do think it's worth noting that in this career that you've had, where you perhaps didn't see the risk, but when you did see it, you chose to move forward, that you were the second woman appointed in the state of Pennsylvania as a Secretary of Health. There's no question here, just I think something worth noting, that your immediate successor and the current acting secretary are both women. I find that interesting and wondered if you wanted to comment on that.
I was thrilled with that, and I never really, I didn't know that until, and I think I told the story when we were prepping for this, but I knew that I was the second woman when I walked into a room and it had all the pictures of the secretaries of health, and there was only one other woman on the wall, and then I was on the wall. So recognize that was the story. And Dr. Rachel Levine, who went on to be, worked closely with me. She was the physician general when I was the Secretary of Health. She went on to become the Secretary of Health, and really proud to say she's a good friend, and she's now in DC working in the Biden administration. So proud of her. And then certainly Secretary Bean, who's doing a great job. I don't think I can't even imagine really what this pandemic has been to lead through from their lens. So I applaud them. They are competent. They were tremendously competent. Allison is competent. And really leading the state of Pennsylvania remarkably well.
Well, I applaud them as well. A question from the audience. What do you see as the greatest talent development acquisition needs for health innovation ecosystem in the next several years? Who do you need to hire?
Interesting that, I will just mention this before I answer that question. There has, and I'm sure you're seeing to some degree of this at Lehigh, we have never seen workforce shortages that we're seeing now in every single solitary area. So I just got a call this morning that there was a resignation, companies offering, doubling salaries to get project managers I mean, that's just an example, project managers. We're really in need of, when you look at digital health, those that are developers, those that understand human-centered design, understand, and I will note too, those developers are all getting offers from not only every other healthcare system that's trying to build a digital strategy, but the Amazons, the other disrupting companies that are developing digital technologies for their consumer base. So I would say heavy on the tech side. I think on the talent acquisition, we always need business partners to partner with. I think for us, hiring people, the challenge is really hiring people that can see the big picture and understand what it is that we're trying to accomplish, and what is the best way to hold the organization's hand through that in terms of leadership. So I would say definitely on the tech side, change management, human-centered design, for us from an innovation perspective is really, really very important.
So how effective has it been then for you to extend your ability to...
Attention, an emergency has
There's an
been
emergency being reported, so I'm going to mute for a second.
Attention, an emergency has been reported in this building. Please cease operations and leave the building utilizing the nearest exit or fire exit stairway. Do not use elevators. Repeat, do not use elevators.
So Beth, I'm going to turn this over to you.
Yeah, I was going to say, it sounds like
hopefully I will see you all in the next few minutes, but if not, it's been my pleasure and privilege to participate.
Thank you, Lisa. Stay safe.
Yeah. Wow, that was unexpected. Okay, hopefully everything's okay up there. So I'm going to take a question, if you don't mind, Dr. Murphy, from a student who's written in. So he asks, what is the screening process for determining when a solution is perhaps too specific or is Geisinger bounded versus a solution that can be applied broadly?
So I think I would go back to my original comments of Geisingerizing. So there are some solutions that we do have to Geisingerize. And what I mean by that is they're not generalizable to the whole healthcare industry. That they're designed very specifically for Geisinger. But our hope for Connected Care 365 is that we actually develop a model that can be transported outside of Geisinger. And we really, we enter several co-development agreements with vendors that allow us to develop together solutions that break the bounds of just the walls of Geisinger.
Yeah. So in addition to, so once we are actually post-COVID, let's hope we can get there. Once we're actually post-COVID, in addition to the projects that you have that are ongoing, that have, sort of a 5-year timeline, what do you see as some of the next big problems you guys will be turning to? Do you have a sense of that?
I think it's going to be, I think it is really going to be competing with the disruptors.
Yeah.
So when you think of the relationship you have with the primary care doctor, traditionally you went to the office, you got to know the people in the office, you got to visually sit in person across across the table from the doctor. You developed a personal relationship. As we enter this virtual world, how are we going to have a relationship with our patients
Yeah.
that is truly a relationship that's a beneficial relationship to them, and one that will engage them in a way that they will stay with us? Because again, I'm most worried about that relationship. I can go to a telehealth visit in a kiosk all I want, but if I have a heart attack, I've got to go to the hospital.
Right.
And I have to be treated in the hospital. And I think that's really going to be I think that's really going to be our biggest challenge as we move forward, is how healthcare is not like buying books. There's a human connection here that has to be maintained. And how do we do this in this digital world?
It's a really interesting question. And I think too that there's a ritual of the physical exam. And there's a doctor who wrote about this, but there's a ritual in the physical exam that can help make both the patient and the doctor sort of understand their roles and be comfortable. Like there's, ritual matters in our lives as humans. And so what role will that end up playing, right? Or and so where will that go? Or where will our need for that go? It's an interesting question. At the same time, I can really see the advantage for more kind of routinized processes. Yes, AI can do that. So yeah, it's going to be an interesting world for sure. One thing I'm really interested in, I think some of our students who are tuned in might be interested in, is just the two different major sectors you've worked in, working in the public sphere, both at the national level and at the state level, and then working in a private hospital system. What kinds of, I don't know, skills, I guess I would say, did you bring from the public sphere to your position now? And of course, we're going through another hospital system, but let's just say, what did you bring from that public sphere into the private sphere?
I think leadership is leadership.
Yeah.
So I think the leadership lessons that I learned in the private sector translated well to the leading in the government sector, but I loved the public sector. I loved the federal and state government. And it is completely, I learned every day that I was there in both the federal and the state side. And, on the federal side, your denominator is the country's population. Yeah. And on the state side, your denominator is the state population.
Yeah.
So, and you're with an army of people that have dedicated their career public servants that have dedicated their life. So I would say the only thing that translated to me was the leadership skills that are required to work at that level. That was very helpful to me, but the rest was all new learning.
Yeah. And how would you define those leadership skills? So what are, top qualities in your experience in a leader?
I think, I always start with empathy to understand where people are coming from. And I think also important as a leader to have a clear vision of what your team or what your organization wants to accomplish, because if you don't know where you're leading to, you're not going to know when you get there. So I think having a clear vision of what you're trying to accomplish and where you're trying to move the organization to was really important. I say empathy because I think without emotional intelligence and being empathetic and kind and treating people with respect, you could be the most brilliant individual as far as IQ goes, and if you don't have those traits, I don't think you get very far as a leader. So those traits are really important to me.
Yeah, no, that's really great. And you talked about the sort of challenge of getting others, when Lisa asked you about obstacles to innovation, you talked about the challenge in terms of getting others to buy into your priorities, right, to help move forward. And what do you do? Like, what is convincing to people? Is it sort of those outcomes that you shared with us, you know, that we can really see, okay, well, this saved this much money and you know, help this save 5 to 6 lives, for example, you know, with the colorectal screening process. What's convincing? And do you try to use different kinds of rhetorical approaches to different groups that you need to come on board?
It took us a long time to build credibility.
Yeah.
In the org, because some people don't even believe you should have a Steele Institute. You know, I mean,
Right, sure, just do the work.
Like, just do the work. I mean, that. So I think building the credibility was important, but at the end of the day, we should be able to demonstrate those outcomes. I mean, if after 5 years we can't demonstrate that we've moved the needle, then we probably need to take a look at a different approach. So I think people are a lot more supportive when you get a couple wins.
Yeah.
And they can buy into it, enhances the credibility of the work.
Yeah, that makes a lot of sense. So there's almost a PR piece here.
Oh yeah,
like a sharing of results, to put it less.
Oh, absolutely. We actually talk about it. This is one we got to do for PR.
Okay.
You know, we actually look at some things and go, you know, we wouldn't necessarily want to go there, but the PR value of this is really important. And because when you really come up with something that's fundamentally different and you want to try it, you have to have support in order to do that.
Sure. That's great. Well, as the College of Health starts thinking through the role we can play in health innovation and technology, you know, Lehigh, you know, we have certainly strengths in business and engineering. We have a great arts and sciences college and a great graduate programs in education. What would be your sort of hope for us, or where would you see, you know, a need that we could address? I know this is like a big question with very little data, actually, but I'm curious to know what you think about that.
I think, you know, I think providing students with educational opportunities, they're going to translate into them being able to make a contribution. I think, and that's a very broad answer to that question. But I think that's really, you know, from the perspective of the school, I'd want to ask myself, is this program really going to be able to make a difference?
Right.
And if the education in that program is really going to make a difference, then, you know, I think that's a definite yes. I think educational programs in the past sometimes have not met the needs. They may meet the needs of a few, but they don't really translate into making a real difference. So I think that's the important question that as educators you have to consider.
Yeah, that's really excellent advice. You know, we are a kind of startup, right? And so a lot of what you said today resonated with me in terms of thinking about the College of Health, how to build it, how to, you know, get others to share our vision and priorities, and certainly how to measure the outcomes and decide if all the pieces of what we're doing, you know, sort of what's working and what isn't. So anyway, I really enjoyed this. And I want to thank you so much for taking time to share your work and some of your own history. I think everybody on the call, I'm sure, enjoyed it as well. And so I would just like to turn to the folks who've joined us and say, we hope you will join Lisa and me on Friday of this week in the opportunity room to dig in a little bit deeper and figure out what really resonated with you and use some design thinking to get at approaches to that. And then I also want to invite everyone who's on board today to join us for our future colloquia, which are coming up. Our next one is Rebecca Jacobson, who is the president of Astrada, which is as I said, a natural language processing a natural language processing company. It's a startup. And so that'll be really interesting. So thanks, everybody. Hope to see you on October 20th, and have a good day.